Welcome back to the show Talk with Your Doc. With me is Dr. Abu Bakare, Endocrinologist in Thunder Bay, Ontario, Canada. Thank you, Dr. Bakare. We were talking about signs and symptoms and various investigations for diabetes. Now, once somebody is labeled with a diabetes and one is diagnosed with a diabetes, what are the treatment options available?
Well, the treatment options, again, would depend on the level. I mean, we did mention pre-diabetes. Obviously, the treatment for pre-diabetes is mostly lifestyle changes to try and make things less likely to progress. Once you are diabetic, what we do first is then monitor the blood sugars, okay? And we also monitor the hemoglobin A1C. They are standards set up by most associations. In Canada, is the CDA, or the Canadian Diabetes Association, suggesting what to do. Well, the basis of all the treatment in type 2 diabetes and to a certain extent type 1 diabetes is diet. So diet and lifestyle changes are constant.
Change the lifestyle, change the diet, the diabetes might get control by itself.
You might be lucky to get control for the first few weeks or months or even more, okay?
Is it curative thing?
Not usually.
Not usually. Once you are diabetes type 2, it's always there.
It's always there, but the blood sugars may be controllable, and then you're okay.
Okay.
All right.
So once you're labeled, you need to change your life.
You need to change your lifestyle.
Otherwise,
it's nothing is likely to happen.
So once you do what do you mean by lifestyle changes? So what sort of diet one should take?
Now, what we're saying is a diet that is not overloaded with carbohydrates. Okay. Now, people then will ask, is it the carbohydrate causing? Of course not. But the thing is, as you mentioned and I mentioned, the diabetes is due to an inability of the insulin you are producing to control mostly the carbohydrates. I mean, the proteins and fats are also involved, but mostly the carbohydrates. So an overloaded system already, if you add more to it, you are more likely to show higher levels of blood sugar.
So when you say carbohydrate, what diet content should be reduced or avoided?
It should be, well, I mean, we expect you particularly to avoid refined carbohydrates. Why do we say refined? Because those are the ones that don't even require any digestion. So the blood sugar goes straight into the system. And so we expect you to take something that has more fiber, that has more complex carbohydrates, that requires digestion, so that there is some slowness in the level of blood sugar rising, and hopefully your pancreas can cope with it.
So when you say refined, that means like instead of drinking the fruit juice,
that's right,
eat the fruit.
Eat the fruit. You're right.
Right?
That's correct.
So when you eat the fruit, you have the carbohydrate and the fiber with it.
That's right.
But if you drink like a whole glass of juice, then you don't have a fiber.
No, you just have it.
Right. And so reduce the refined carbohydrate, have more carbohydrate with the fibers, which means fruits and juices. What else? Whole grain
wheat, whole grain rice, such things. And even if you take the rice, make sure you have some fiber around it. You have some other food like vegetables with it to reduce and modify the degree to which it will go in.
Right. So whole grain rice or whole grain wheat will be good.
That's right.
And fiber containing food. So more green leafy vegetables.
More green leaf and vegetable.
Meat is
sort of neutral.
Okay.
Meat is neutral. So of course, because diabetic patients tend to have high cholesterol levels, we would like to also reduce the amount of fats.
Amount of fat and meat.
That's right.
Right. So how about protein containing diet?
Protein we don't control as such. In fact, if anything, because the body very rarely retains proteins.
Right.
I mean, we don't retain amino acids to a large extent. So, but we retain fat very easily. We retain glucose or carbohydrate. We store it in the liver. So
one fruit a day is good for diabetics.
That's right. The right fruit. Okay. Don't eat 50 grapes a day.
So which is a high glycemic index.
That's right.
So which are the fruits to be avoided?
I would say, I just said grapes. Banana is a typical one because banana is a high. Pineapples and high glycemic. But things like guava is fantastic.
Right.
The grapefruit is fantastic.
Apple is good.
Apple is okay.
Right.
And the orange itself, not oranges. Okay.
Not oranges.
Yeah, orange.
Okay. So and how about mango, which I love the most?
Well, mango is all right. But mango has fiber. Mango has quite a bit of fiber. So if you eat the mango, not mango juice. Okay.
Right. Other than the diet, how about exercise?
Well, the exercise is sort of, it's not, we now say you should exercise if you can 150 minutes a week.
150 minutes.
You can divide that anywhere you want. You know, if you can do 15 minutes a day for 10 days, you've done the 150, but preferably about 150 a week. So, and some people will say 30 minutes to 45 minutes daily. Right. So those are the recommendations. A brisk walk, and don't have to do it all at the same time.
Right.
You can, if you're doing 30 minutes, you can do 10, 10, 10. And
now, exercise, how does it help to control the diabetes? Does it break down the sugar, or what does it do?
Not really. We think exercise increases sensitivity to your insulin.
Okay.
It sort of helps the metabolism and makes your insulin a little bit more effective than it would have been.
So if you do regular exercise, your insulin will act more.
A little better.
And reduce the sugar levels.
That's right. Yeah.
Right. Now, once one does the diet and the exercise, and if required, what sort of medications?
Well, we have groups of medications that we have. The most common one that's recommended is metformin to start with in almost every type 2 diabetic patient, unless they can't tolerate it. We will recommend this starting with metformin. Right. And then, of course, you progress depending on the level of blood sugars and what we call the hemoglobin A1C. So you can go from metformin to another group of drugs. The more common one in the past would have been what we call the sulfonylureas.
Yes.
The sulfonylureas will include glyburide, glycoside.
Right. Now, if somebody is taking these oral medications, then at what stage one needs the insulin? Injectable insulin, they get insulin injections?
Well, the insulin injection at stages, things have changed quite a bit. In the past, what we did, we gave you all the drugs that we have at the beginning, and if you finish all of them at the maximum dose, we go move on to insulin, because then you have no other recourse. Okay. Now we feel that there are so many drugs on that insulin may in fact come in earlier if you agree for it to be reintroduced. So, for example, if you were on drugs and your blood sugar in the morning is extremely high, then insulin is probably the best drug to take at bedtime to try and reduce the blood sugar in the morning than keep piling in the medication. It's just that we have so many classes of medication that we can actually use. And we can combine, say, some of the medications with insulin. So it's not an exclusive. In the past, all we did was, well, you're on insulin now, we give you insulin, and you'll be on insulin 4 times a day.
People can get insulin resistance also, right, after taking the insulin?
Well, insulin resistance in the sense of not building it up, insulin resistance is always there.
Okay.
I mean, once you're type 2 diabetic, the insulin resistance is always there. The drugs that are meant to either bypass it or make you, in fact, more sensitive is what we have now.
Right.
There was only one class of drugs that actually tackled insulin resistance, but they're not a popular drug at this time.
Now, just about recent advances, is the pancreatic islets and transplantation. Can you tell us something about that?
Well, islet transplantation has always sort of been there either in a crude or in refined form. We do have pancreatic islet transplantation, mostly from Edmonton in Canada, and they've been successful in the transplantation. What has been the problem is the retention of a transplant to stay on, because if you transplant islets, the body brings out the same antibodies that damage your own pancreas. This is in type 1 mostly, though, okay? Damage your pancreas, we damage the islet. So you would require another set of islet cell harvest to put in more islets. So the initial success is sort of tempered by the fact that you may require several transplants to be able to maintain either going without insulin or going with small amount of insulin. So the success has not been as high as one would have expected or also expected. Maybe our expectations was too much. Okay.
Right. Thank you, Dr. Bakare. Thank you so much for enlightening us for so much about the diabetes. Thank you very much.
It's a pleasure.
Thank you for joining us.